As a lady, if you've ever had pain in the lower abdominal region, that's your pelvic region, this video is for you. If you've ever had abnormal vaginal discharge, this video is for you. If you've ever had any odor coming out of your vagina, that's from the discharge, this video is particularly made for you. As a lady, if you've ever had painful urination, this video is made for you. Then, if you've ever had pain during sexual intercourse or you had irregular menstrual bleeding, this video is made for you. Why did I say this video is made for you? Because all the symptoms that I've mentioned is pointing towards a particular infection. It's very common. We've had different people come into the office and they complain of this particular infection. That's why we are here to talk about it. That's why we are here to educate people. So you need to listen to this video and you need to share this video out to every other person that you think it might help them. So please stay tuned while we talk about the infection, the pelvic inflammatory disease. So today is all about pelvic inflammatory disease, and we are going to talk about the causes of pelvic inflammatory disease. We are going to talk about the symptoms of pelvic inflammatory disease. We are going to talk about the treatment for pelvic inflammatory disease. And lastly, we are going to talk about things that you can do to ensure that you don't get this pelvic inflammatory disease. So stay tuned while we go ahead. This is your first time of joining our channel. My name is Raphael, and in this channel, we talk about everything that has to do with diagnosis. We talk about everything that has to do with health. We try as much as possible to break down every complex medical term to easy absorbable form that each and everybody can understand. So this video is made for the general public. This video is made for educational purposes. So please stay tuned while we talk about pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the female reproductive system, including organs like the fallopian tubes, the ovaries, and the uterus. It is a serious condition that can lead to serious complications such as infertility, chronic pelvic pain, and if it is not treated, it can lead to ectopic pregnancy. So it's a very serious infection that you need to pay attention to. PID is usually caused by bacterial infection. Oftentimes, it is being transmitted through sexual method. And the most common cause of PID is gonorrhea and chlamydia. Chlamydia and gonorrhea, they are just the most common cause of PID. But that does not mean that you can only have PID, that's pelvic inflammatory disease, from gonorrhea and chlamydia. You can also have PID, that's pelvic inflammatory disease, from post-surgical procedure. You can also have it after childbirth. You can also have it from abortion. You can also have it through IUD, that's intrauterine device. But that's not all. Most importantly, you can have PID from untreated genital tract infection. You can also have PID when there is an overgrowth in the normal vaginal flora. What I mean is that there are some bacteria in your vagina that they keep the system intact, they keep the vagina intact. So it's like a perfect ecosystem that ensures that everything works normally. When there is an overgrowth of this normal flora, it leads to an infection, which is pelvic inflammatory disease. PID symptoms could range from mild to severe, and they may include the lower abdominal pain, in which I've discussed before. They may include pelvic pain, painful urination. Some people, they have pain during sexual intercourse. And in most cases, people also have irregular menstrual bleeding or spotting. In fewer cases, people have nausea, fever and chills, and vomiting. Yes, some women may have silent PID. That means that some women not even have any sign. It shows no symptoms in them. They may not even know that they have pelvic inflammatory disease. And this increases the risk of complications due to delay. So the more you delay, it can lead to ectopic pregnancy, it can lead to different things, it can lead to spontaneous abortion. So the laboratory test that you can do for pelvic inflammatory disease is vaginal swab. In most cases, full blood count may reveal elevated white blood cell count. In that case, we also know, okay, fine. If the white blood cell count is elevated, it also points to a particular thing based on the other symptoms that's presented itself. Urinalysis will also be done to rule out urinary tract infection, and we are going to do the pelvic ultrasound scan. PID can be treated. Yes, there's treatment for PID, and this particularly involve the use of antibiotic therapy. But you are not just going to take antibiotics without any proper test. You need to do proper test first before you know the antibiotics to go for. And most importantly, if you have a partner, your partner needs to also treat himself. Let us assume that while you were infected, you pass it to your partner. Now that you are treating yourself, your partner needs to also treat himself. You need to avoid any sexual activity until your treatment is completed. For future partners that you are going to have, you ensure that there is proper screening to ensure that your partner does not have any infection. That's for other partners. Let us assume that you don't have any partner for now. So for you to have the next partner, you need to ensure that test is being done for the person and the person does not have any infection before you go ahead. So as we said earlier, PID can lead to infertility. It can lead to blockage of the fallopian tube. It can lead to ectopic pregnancy if treatment is not done. If you find this video helpful, don't forget to like, don't forget to share, and don't forget to subscribe for more informative health content. So stay tuned for our next video. Thank you.